Before we begin the webinar, a few quick points about the setup and a brief background on BREAK for those of you less familiar with our work, before handing over to today's speakers. We have representatives for Vision Express, Aston University, the World Council of Optometry and Ashfield Healthcare, all experts in their field who will be able to share their knowledge with you. Before we begin today's webinar, I'd like to say thank you to Vision Express who sponsored this webinar, and without whose funding we wouldn't be able to deliver this session for you. So now you should be able to see my presentation and hear the audio alongside it. As attendees, you're all muted, so you don't need to worry about any background noise from your offices. After each speaker, we'll have the opportunity for a Q&A session. There are two ways to put your question to the speakers. Firstly, there is a chat box on the webinar panel where you can send your question at any point during the speaker's presentation, and we will put that question to them at the end of their session. Alternatively, there is a raise hand icon on the same panel. You can press this during the Q&A and we will unmute you, and you can put your question to the speaker directly over the phone. Now I'm just going to give you a very brief overview of BREAK, who we are and what we do, before handing over to the first speaker. So BREAK is a national road safety charity that exists to stop the needless deaths and serious injuries that happen on roads every day, make streets safer and communities safer for everyone, and care for family stories of injured in road crashes. So our vision is a world that has zero road deaths and injuries. These are our four key aims. BREAK's vision is that people can get around in ways that are safe, sustainable, fair and healthy. And we do this through our three main focuses, which are support, campaigning and education. So in terms of support, we run a helpline in the UK for people bereaved and seriously injured in road crashes. So you can see some information on the support our helpline can provide and the level of support we gave in 2015. In addition to the helpline, we also provide support literature, which you can see on screen now, and work very closely with police forces throughout the UK, so that when someone does receive that knock on the door from a family liaison officer, they're providing them with the best practice support literature. We also campaign nationally and regionally to raise awareness among the public, but also to lobby government and push for change in road safety legislation. So an example of this is our 2016 Road to Justice campaign, which centred around getting justice for bereaved families. The campaign launched outside Parliament and gained a lot of media attention and resulted in the government opening a consultation on criminal driver sentencing. We also do a lot of campaigning more generally on raising awareness of a range of topics, some of which you can see on the screen now. So as you can see, campaigning makes up a lot of what we do, and here are some ways in which we do it. And the final side of what we do is awareness raising and education in communities. This is done through projects such as Beat Beat Days. These are run with nursery school children aimed at raising awareness and teaching them about road safety at a young age. It's also a great way for some of the corporates we work with to get involved, go out into their local communities, and that they are passionate about show they are passionate about road safety and want to help the communities they operate in. And the other side of education is that we work with employers of at-work drivers through our BREAK Professional Membership Scheme. This global membership scheme was founded in 1996 and aims to share best practice amongst employers. We run an annual calendar of events, including webinars such as today's, and seminars and training throughout the year. We also have annual flagship events such as Fleet Safety Conference and Fleet Safety Awards. So those are open to companies of all sizes. The conference brings together professionals to share best practice and is an ideal opportunity to network with people in the industry. And the awards are open to anyone and free to enter, and aim to highlight the work companies are doing to ensure their fleets are safe on the road. In addition to these events, we also produce a lot of resources for employers, including guidance reports on introducing policies and share best practice case studies. Alongside that, we provide employers with tools to use directly with their drivers. So you can see on screen some of the posters, infographics, and videos you can use to engage your drivers. So on to today's webinar, I'm going to hand over to Dr. Rebekka Heitmar, who is our first speaker, and she will introduce herself and tell us a bit more about specific eyesight diseases and how you can help combat them in your field. Hi, Rebekka.
Hello, can you hear me?
Yes, yes.
Oh, wonderful.
Do I, Rebekka?
Wonderful. Let's see. Right, can you see my screen now?
Yes, that's perfect.
Brilliant. Right, I'm going to talk to you a little bit about diseases and age-related ocular conditions that can affect your vision. We'll have a very quick journey through the eye and just have a few, cover a few things. Age-related macular degeneration, something most of you will have heard, probably cataract, glaucoma, and a couple of diseases that can lead to disorders in your vision, and a few more common factors. Now, I'm not sure how many of you have had a look at the cross-sectional view of the eye. I just thought I'd bring one up so we all know what we're talking about. What you can see here, I put a few light rays in to illustrate how the light's passing through the anterior proportion of the eye, through the lens, and then it all meets up on the macula. And I'm sure you've heard about people with macular degeneration, or that said that they have problems with their macula. This is when people have problems in the central region. They might have problems reading, seeing fine detail. But there's a whole lot of structures that you can already see that can be affected. And depending on which one is affected or what kind of underlying disease you have, how this affects your everyday life. Now, age-related macular degeneration, so fast forward through here, this is a view of the back of the eye. The yellow patch here is what we call the optic nerve, and you can see a couple of vessels, almost like a roadmap coming out of that nerve head. Those are arteries and veins that nourish that internal structure. The macula is a quite large area, and the very center of that we refer to as the fovea. It's a very small area, but this allows you to see everything in fine detail. Now, age-related macular degeneration is a disease is mainly associated with age, and that it gradually destroys the central proportion of your vision. This central proportion is crucial for you seeing fine detail and for everyday tasks such as reading and identifying and focusing. So when we have a look at those images here, I thought it's easier to look at a couple of images so you can imagine how this looks like. In a few slides before, we've had a nice view where we could see the optic nerve head and a couple of vessels. On the right hand image, you can see another background of an eye, but this one is of a person who's got macular degeneration. And you can see it all looks a little bit patchy with yellow patches, and right in the center of the circle where I put the arrow on a very dark area, this is how it affected the structures there. Those yellow patches are deposits in the retina. Those dark areas are already areas which have died and which most likely there is no vision left. And when we look over on the other side, I put up a printout from another way of how we can image the back of the eye. You can see on the lower part a cross-section through the eye, and you can see there's some lumps and bumps on the bottom. So in that cross-section, it's just to illustrate where those lesions are within the eye. Now, there are different types of age-related macular degeneration. There's a wet form and there is a dry form. Those suffering from the wet form, there are abnormal blood vessels growing underneath the retina, and they are leaky. Those leaky blood vessels then leak fluid and blood into the retina, and therefore cause the whole thing to lift up, and a lot of edema, and this will lead to blurred vision, but also can lead to very rapid visual loss. Now, wet AMD is also sometimes called as what we say advanced AMD. There are no real distinct stages. Some of the early symptoms might be that people come in and complain or report that straight lines don't appear straight anymore, or a bit wavy, or if they look at really straight structures such as a corner of a house, that might appear a little bit wavy, or reading in the newspaper some of the words, all of a sudden there might be a few letters become a bit more wobbly. Now, dry AMD is a little bit different, but it also affects the center of the vision, and here you don't have leaky blood vessels, but you have these little deposits, as we just had a look at before, that can also lift the retina, and if it lifts off, therefore the cells that we need to see don't get enough nourishment anymore and can die. Similar symptoms, the vision might be slightly blurred, or people might complain that when they read it's not quite as clear, sometimes a bit of wobbly lines. Doesn't always affect both eyes, can start in one eye only, and this is often the problem when we always have both eyes open and we read and do everyday tasks with both eyes open. People might not notice for quite a while unless they cover one eye or have a visual task where they might just look with one eye through some device, and then pick it up therefore. Now here is a test which you might have come across. We call this the Amsler grid test. When we print it out and give it to a patient, it looks as the bottom left printout. It's regular shapes of squares. So you have a lot of straight lines and you have a center black dot. So if you have a perfectly normal eye and you don't suffer from age-related macular degeneration or any central vision problems, you should identify all those nice straight lines and not have any distortion. Now, for someone with macular degeneration, that might look a little bit more like the grid presented above. So those squares don't look like nice squares anymore, and the lines aren't straight. And if we transfer this into everyday tasks, how vision might look, normal vision as illustrated in the view on the bottom, the two boys with their balls, and if we have a look at the top one, if that patient would be a patient who suffers from AMD, might look at the boys' faces and cannot really make them out, because wherever they want to focus on, that might it's affected by the central vision loss, and he can't see that fine detail. You also notice that all the surroundings are a little bit more blurred as well. There are a couple of risk factors, and as always there are some that we can't influence. Gender would be one. However, there are plenty that we can influence, apart from age, of course, which is a major risk factor. So smoking, your diet, lifestyle, sunlight exposure, genetics we can't modify, family history, again, we can't modify. But there are a couple of things that you can do about that. You can lead a more healthy lifestyle, exercise, change your diet, a bit more balanced. Green leafy vegetables are thought to be much better for people that suffer, not just suffering from age-related macular degeneration, but in general to be good for your eyes. There is also a range of supplements that are recommended. One for them would be lutein, and you might have come across that. The other modifiable risk factor would be smoking, so stopping that would be a good move forward, and then using sunglasses as well. So if you're in a bright environment and you need UV protection, you should wear them. Now, when it comes to treatment, there isn't an awful lot of treatment out there. The majority of patients suffer from dry AMD and there is no treatment. The only way forward there is when we pick these things up in practice. We will monitor the patients regularly and we will give them some advice on how they can modify their risk factors, such as on their diet, doing a bit more exercise, what protective eyewear they could use, but also on illumination. If they work in a certain environment, they might use different lighting. For wet AMD, it looks a little bit different. There are injections available which will reduce the growth of those new blood vessels. And it will also reduce the amount of swelling which comes about when those blood vessels leak in the eye. Other than that, patients will also be advised on a healthy lifestyle and improving their modifiable risk factors. Now to the next topic. Cataract is also an age-related condition. There your lens is getting a bit cloudy or yellowish over the years. It's using its transparency, and therefore you can imagine a little bit like as if you look through a lens that's a little bit yellow tinted, and everything becomes a little bit more dull when you think of the different colors. You lose sort of the vibrant colors in that sense, that they become more dull, everything becomes a little bit more dimmed down. Now, apart from developing this naturally through age, there are a couple of other causes, such as surgery for other eye problems or other health-related issues, traumatic cataracts. Some people can have this from birth, or radiation cataracts. They're classified depending on the way they present, but I put in a little picture here with the two eyes where you can see a cataract from a close-up picture. Now this is a very dense cataract on the left eye, where you can see the lens in the eye looks very milky, so not a lot of light getting through there anymore. On the other image you can see almost like a cross-section, so again it's not nice and clear. It appears a bit milky and a bit denser in different areas. Now if you imagine looking through such a lens yourself, you can see in the photograph of the traffic scenery that while you can notice most things in the scene, you couldn't make out, for example, the stop sign properly. You could see the sign, but you might not see the letters properly because the contrast is getting lower and lower. Symptoms in general, people complain about cloudy or blurry vision, or complain that the colors fade a little bit. They might have glare, headlights or lamps or sunlights might appear too bright, and often during night, if they're driving, they might complain about poor night vision and a lot of glare around headlights. Another type of symptom might be that if they're wearing spectacles already, that their prescription is changing a lot of times. Now, the treatment for cataract is usually the lens replacement. There are no clear national guidelines, but it depends on local CCGs, as in when the cataract can be removed. Now, there isn't always a treatment necessary, and until it is getting ready for lens replacement, those people might benefit from new glasses, a little bit brighter lighting, depending on where they work, anti-glare sunglasses, and in some occasions, magnifying lenses. There is no medication to change this, or dietary supplements. This is what brings age about, and once the cataract is advanced enough, it will be replaced with a new plastic lens. Another condition which can come about through age, but also a lot of other factors, is glaucoma. And glaucoma isn't a clear-cut disease where we can say you have this, and that. It's more a syndrome, and every patient can present quite different. It's more of a group of conditions where the optic nerve, all the nerve fibers that leave the eye that process the information that we see, is damaged. Sometimes this can be brought about through high pressure. Sometimes this can be brought about through poor circulation. Now, vision isn't always immediately affected, but in the long run, as this disease progresses, your peripheral vision can be affected, and as it goes on, it can also have an effect on the central vision. So regular monitoring is crucial for this. So a regular eye test at your optometrist, where they will measure your intraocular pressure. They will measure your visual field, so this is how far you can see while you look at scenery maybe in front of you, how well you can notice objects coming from the sides, very important for driving. They'll also have a look at the structure within your eye if that's affected. Now, there are a couple of risk factors as well, such as family history, age, race, genetics, or if you had previous surgery or trauma to the eye, and some medication can have an effect. When I talk about medication, I mean if people have been on steroids, for example, that can increase the intraocular pressure, which could potentially damage the nerve. In regards to race, Hispanics and blacks have a higher risk of developing glaucoma. But those are just a few factors. Another important thing, I think this is an image that I copied in from the Glaucoma Association's webpage. Men are 60% more likely to have serious sight loss from glaucoma through presentation late at the eye clinic. So this is something really to bear in mind. What are the patients we're looking at, or in respect to employees, who should we be worried about a bit more, or give a bit more advice? So men obviously seem to present late. It's not something that is painful when it develops, or not at the initial stages, so it doesn't get noticed if you gradually lose a little bit of your peripheral vision unless you get tested regularly. Now, with glaucoma, there are lots of different types. Some we would refer to as primary or secondary glaucoma. It depends a little bit on the structural representation. Are there any other underlying diseases? There's also one type what we refer to as ocular hypertension. It's a little bit like high blood pressure, but it's in the eye. And then there are patients that suffer from glaucoma or vision loss related to glaucoma, despite everything appearing normal in regards to pressure. There is a wide range of surgical interventions, and you can use eye drops to lower the intraocular pressure. There is also a couple of underlying diseases that can have an impact on the development of glaucoma. Now, disease-related ocular conditions. Patients suffering from diabetes can develop ocular problems. Now, you might be aware there are different types of diabetes, type 1 and type 2 diabetes. Type 1 is when the onset is really early in your teens. Type 2 are mainly individuals over the age of 40. There are a couple of risk factors such as genetics, family history, race, but also obesity and the lifestyle if someone's more active or more sedentary. Age, with increasing age, you're more likely to develop this. And then there are some different forms like gestational diabetes, when patients can develop this during pregnancy. Now, patients that might not know that they have diabetes yet, or when you hear about individuals with various symptoms such as polyuria, where they have to frequently urinate, polydipsia, where they have increased thirst and fluid intake, or those with polyphagia, which have an increased appetite. Those are some hallmark signs. So if people complain about being thirsty all the time and really drinking well above normal and have an increased appetite, and they might still lose weight, those are individuals that should be advised to seek some help. Now, there are other common symptoms, weight loss, and often weight loss while they still eat a lot and drink a lot, blurred vision sometimes if it's already advanced, tingling or numbness in hands or feet. There could be lack of energy, constantly a bit tired, dry skin, and so on. But those are more rare. Now, what's out there for diabetic patients to make sure that we keep a track on how their vision is going? There is a screening program in the UK, and all patients over the age of 12, which have been diagnosed with diabetes, are invited for a free annual screening. Now, this screening is provided through different services, sometimes through GP surgeries, optometrists, the hospital, or other local services. There are well over 250 million with diabetes, which are identified in England alone. And every year, we think there are around about 4,200 people that are at high risk of getting blind through diabetic retinopathy. Now, the screening is a very efficient way and can prevent a lot of sight loss because we pick up those patients early. And at the beginning, however, patients are often reluctant to join the screening program simply because they might have still very good vision, and it's another trip to the optometrist or GP, and nothing has changed. But it's really crucial and should be recommended. Hypertension is another systemic disease which can affect your eyes. So when patients have high blood pressure, that can have an impact on the eye as well. I just put in here an overview of how we classify hypertension. When do we think someone has hypertension? A lot of times when you read around magazines, you'll hear 120 over 80 is normal. So anything below 130 over 80 is what we consider normal. If it does come up a little bit up to 140, the higher value, then we think it's high but still normal. And those levels have been reduced over the years as we see more problems, even though the blood pressure might not be as skyrocket high. Now, how do patients present? This is often very rarely picked up in the early stages because you might not have any particular pain. However, if asked what's going on and how their general health is, a lot of times we find out they have severe headaches, fatigue or confusion. They might have some vision problems, a bit of chest pain. They can have difficulty breathing or irregular heartbeats, blood in the urine, pounding in the chest, neck or ears. And these would be hallmark signs of sending them off and having their blood pressure checked. There are, of course, other risk factors, and the more signs and symptoms there are in combination with risk factors, the more serious one should take that. So overweight, obesity, smoking, no exercise, drinking too much alcohol or eating too much salt in your diet, and a family history as well as that linked with race. Hypertensive retinopathy can affect the eye in the way that if you have too much pressure in your arteries and veins, this could lead to a lot of damage, as we can see in this image, where the patient had a vein occlusion, and therefore you see a lot of bleeding areas, a lot of deposits. Now, hypertension is particularly dangerous because it can lead to stroke, which again could lead to vision loss, and it can be the first step towards more serious cardiovascular disease. Cardiovascular disease itself can lead to vision loss due to a disturbed blood supply. So if the eye isn't nourished sufficiently anymore, you can lose your vision through that as well. Abnormalities including color vision, this is often more linked with the medication taken when you have heart disease, but this is usually reversible. In severe cases, you could lose your vision due to a blockage in retinal arteries or veins, where you might have a thrombus formation which travels all the way up to the eye and could block one of those arteries or veins, and therefore you could lose your vision. Stroke is also another consequence due to high blood pressure or cardiovascular disease, and depending on the location of the stroke, the patient could lose large or smaller parts of their visual field. Now, here I have an illustration. I know this might be a little bit difficult to view, we have the two eyes and our sockets and how our fibers are linked with the brain, and the little black patches illustrating where there might be a visual field loss, so we can find out at what level in the brain, or if it actually is still within the eye, the problem might have occurred. Sleep apnea is the last thing I'm going over in regards to diseases that can affect the eye. Symptoms here might be fatigue, poor sleep quality, people often nodding off, very, very dangerous in regards to driving. People might also complain about having very low energy levels despite having rested for long enough. Those patients have a higher risk of developing glaucoma in the long run if untreated. Now, other more common factors affecting your vision. These are two pictures I've taken myself quite a while ago, driving in Iceland on a nice winter day. Depending on how your environment is, you might have very poor visibility, and then in combination with any refractive error, so are you far-sighted or short-sighted, that might affect your vision as well. These, of course, we can correct with glasses, but again, they have their own little problems depending on whether they're high-index glasses, extra thin ones. They might cause a couple of halos with colored fringes around light sources. And then anti-reflective coating is something we'd highly recommend, especially for people driving. As you can see in the two images below, or four images I should say, the lady wearing on the left-hand side lenses without any anti-reflective coating, and you can see how difficult it is to see her eye behind that. This is equally difficult than looking through those lenses, and this below with the cars is just a driving scene, how the differences would look whether you have an anti-reflective coating or not. Depending on how old you are, you might not just require correction in the distance, but also at near. A lot of people wear varifocals these days, which will make them able to read, but also look at distant scenes, and just while they wear one pair of spectacles. On the left-hand side in the illustration, this is just a schematic to show you that those lenses on the more top proportion cover the distance prescription, so they are meant to look at the distance here. In this intermediate section, this is meant for distances around about 1.5 to 2 meters. So let's say if you want to look through a shop window and identify something in there, and the lower proportion for reading and things that are close up. So if you sit in a car, more like on your dashboard. On the right-hand side, there is a little illustration which shows you just sort of a view through such a lens as a schematic when sitting in a car. Now, here those intermediate zones are very wide, which isn't the case for most of those lenses. So on the right and left, separated through the white lines, you see the proportions which aren't quite clear. So wearing these lenses means you will have to learn also to make a lot more head movements, and also learn that when you look in your rear mirror, that you might have to look through a different proportion of your lens to see clearly. Thank you. So if you have any questions, please do let me know.
Thanks, Rebekka. That was really great. We had a question about how to effectively highlight these health risks to drivers, because obviously they fit into fleet drivers into quite a few high-risk categories, including the sedentary lifestyle. They sit a lot for work, but obviously this is quite it's a difficult topic to cover because it's quite academic, and it's not always the easiest thing to present to drivers who are kind of in and out of depots and aren't always available for a longer presentation. So how would you say was the best method to communicate this via like bulletins or notice boards?
I think the problem is often that while people still have really good vision, that they do not see the need of having their eyes checked. I think to bypass this a little bit would probably be by running a little bit more regular health checks, and combining these, like measuring blood pressure, having a look maybe about their smoking status, and giving some advice on this. And combining it with a visual checkup. And there are quite a few places that do that these days. Then people, I think, will take it a bit more serious.
Yeah, okay, that's great. Thank you so much, Rebekka. I'm just going to hand over to Omar from Vision Express now.
Thank you very much. If we could you just put the first slide up, if that's okay?
Yeah.
Great.
Yeah.
Great, thank you.
Sorry about that. There you go.
It's okay, no problem. Thank you very much for handing this over. Good afternoon, ladies and gentlemen. I'm Omar Hassan. I'm from Vision Express, and I head up professional services as part of the company. And my main remit is to set up best practice clinical standards across our optometrists and ensuring our employees are trained to highest industry standards on eye health. I'm just going to hope to highlight the important message of looking after your eyesight and eye health. And today I'm going to show you how the simplest of measures can ensure that all drivers can easily fulfill their responsibilities in maintaining excellent vision and eye health. But before I divulge, you'll be glad to know that there's only one message to take away, and that message is that every one of us should have an eye test at least every 2 years. If we just go to the next slide. Now, just to illustrate how wonderful our eyes are, here is an optical illusion, and if you can try and look at the picture above, there are two desert scenes, and they have exactly the same color composition. The skies are both bluish, and the deserts are both yellowish. If we just go to the next slide. Okay, now with this next slide, if you stare at the dot between the red and green squares for 60 seconds, and then after 60 seconds, I mean, the longer you look at it, the better it'll get. But for the sake of time, when you look back down at the dot between the two desert scenes, what should happen is that the more you focus on the dot between the red and green squares, the better the illusion will be. And what happens is that the desert scenes change color because your brain incorporates its history of redness on the left and greenness on the right, and it applies to the desert scene. It is because part of what we see is based on memory. If we just go over to the next slide, please. Thank you. Now, I don't know if you know, but looking at the statistics, about 86% of adults value their sight more than any other sense. And over 50% of sight loss is preventable, yet just over half of adults in the UK snub the recommended optician visit every 2 years in favor of, worryingly, 1 in every 5 years. In fact, 8% of the population has never had a sight test, and that's around 4 million people in the UK. I'm sure most of you agree that your vision is probably the most important sense you have, and the biggest fear is of losing that sense. Yet only half the adult population have had their eyes tested in the recommended interval of 2 years. And even more startling is the fact that these adults who have not had their eye exam in the last 2 years, or at worst, never even had it, could very well be the drivers on the road that we see. Go to the next slide, please. Now, when it comes to driver safety on the UK's roads, we're faced with some worrying statistics. 1 in 4 drivers hasn't had an eye test in the past 2 years. 1 in 5 drivers has avoided visiting an optician, even if they notice a problem with their vision. 14% of drivers in the UK, that's approximately 5 million people, acknowledge driving with poor vision. And 6% of men surveyed and 2% of women said they had or nearly had a car accident owing to their own or someone else's poor sight. Now, we all know that good vision is crucial for driving, but we do little to take care of our vision. All of us think, and I include myself in this, that we all have perfect vision, but how do we know what we could be missing if we've never seen it before. Now, this is where regular eye tests come into their own. Can you just go to the next slide, please? I mean, regular eye tests are proven to be the most effective way to screen for any potential vision concerns, so that vision can be corrected or maintained. Generally, any reduced vision can easily be corrected by wearing glasses or contact lenses, and the majority of eye diseases can be managed effectively if identified early enough. Here are some of the stories of our customers who have had conditions detected through vital eye tests. And Vision Express, we work with a number of charities such as the International Glaucoma Association, Stroke Association, and the Macula Society, so that we can all help raise awareness of the importance of eye tests and utilize their expertise to train our optometrists, so they are better placed to treat and advise our customers together. If we can just go to the next slide. Now, I just want to demonstrate. Here's some of a familiar image to all of us, and here's a number plate that is quite familiar to a lot of us. Adequate eyesight in order to be able to see the number plate means that you should be able to comfortably read a number plate like this at around 20 meters. Now, in real terms, the standard for Class 2 licenses is quite tough, actually, and it's a tough standard, and has been changed by the DVLA since March 2013. This update is to reflect not only that it is based on a number plate, but also on seeing a particular line on an optician's chart. Now, I'm sure all of us regularly check our vision by glancing at the number plate in front of us when we're driving. But how can we be actually sure that the requirement of seeing that particular line on an optician chart is met? Go to the next slide, please. Now, so what does that mean for all of us? So, as most drivers, we're spending more and more time behind the wheel, and as a result of spending more and more time, there is an increased risk of an accident. And that could be more down to the poor sight of other road users as well as ours. But we still do have a responsibility to safeguard our driving licenses by keeping our eye health in check. And we all have a duty of care to educate and advise other drivers on good eye health practices. The driving standards for sight is according to the DVLA's visual standards. The criteria is that the standard for all drivers is the ability to read in good daylight, that is, with the aid of glasses or contact lenses if you wear them. You should be able to see a registration mark fixed to a motor vehicle which contains characters of the following dimensions: 79 millimeters high and 50 millimeters wide, and you should be able to see this at 20 meters. Or, alternatively, if the characters are 79 millimeters high and 57 millimeters wide, we should be able to see it from 20.5 meters. It also takes into account the visual acuity, and this can be measured with glasses if you wear them, or without or contact lenses. And it must be at least 612 with both eyes open. And for Class 2 licenses, visual acuity must achieve 675 in the better eye. Now, visual acuity is a term which is really given to the level of vision one attains when they are reading the chart in an optician's room. Now, and the police also has recently been quite active on the roadside and assessing whether drivers are able to see the registration mark at 20 meters. If we can go to the next slide, please. So I'm sure you have probably heard of Cassie's law, which gives powers to the police to suspend licenses if they suspect a driver's vision is impaired. Following the death of a 16-year-old in 2011, Cassie, the new law was introduced. Now, she was killed, unfortunately, by an 87-year-old who had failed a driving sight test, but the police were unable to take any action. The new law gives police powers to assess whether drivers are able to see the registration mark at 20 meters, as we discussed before, on the roadside, and petition to suspend licenses within hours, actually, if they suspect a driver's vision is impaired. Now, figures show that since the powers were introduced in 2013, police forces across Britain have applied it 631 times to revoke licenses based on failed attempts to read number plates. And in most of the cases, 609 of them, the DVLA revoked the driver's licenses. And we should all be mindful of that. Next slide, please. With regards to the eye test itself, at Vision Express, our sight tests allow our expert optometrists to detect indicators of eye health conditions and health conditions, such as mentioned before in the previous presentation, such as high cholesterol, high blood pressure, diabetes, and an increased risk of stroke, as well as vision issues. Now, everyone will need to wear glasses at some point during their lifetime. So having eye tests regularly, especially as we reach over the age of 50, can determine any other underlying health issues. It is around this age where we become more susceptible to conditions, including stroke, diabetes, and dietary factors. You may not be aware that changes in sight can be gradual, and it's possible to lose up to 40% of your vision without noticing. If there is one point I cannot stress enough, is that all of us should have regular eye tests. Whether you are wearing glasses or not, whether you're seeing well or not, poor vision can encroach slowly, and you can barely notice it sometimes. 30 minutes of your time every 2 years is all it takes. Optometrists can make you aware of any potential issues and the numerous ways that you can improve your vision and help to safeguard your sight in advance of it deteriorating. We can go to the next slide, please. Just remember that an eye test itself just takes 30 minutes, and it's only every 2 years. And in 2 years, there are over 17,500 hours. According to research, in 2 years, we spend nearly 6 days waiting in queues and 60 hours on hold to a call center. So getting an eye test is a good use of time. Next slide, please. With Vision Express, we have a network of nearly 400 stores spanning the UK and Ireland, which means that no matter where you live in the country, one of our stores will be within easy reach. Vision Express will be offering everyone a free eye test, and a voucher can be downloaded by the link that you see. And you can find your local store by visiting our website as well. Next slide, please. I just want to thank you for listening. I kept it short just to give you that brief message, just one message to make sure that every one of us, and you should ensure that everyone who we've got the power to communicate with should have an eye examination at least every 2 years. Doesn't take long to do, and just thank you for listening. I'm happy to take any questions. No questions?
Thank you, Omar. You brought up that obviously it changes with age. I suppose it's a similar question to what Rebekka covered. How would you suggest managers were letting their fleet drivers know that this, obviously some of these drivers would have come in a lot younger and been driving for the fleet for a number of years. So how would you suggest maybe just making sure that they know from the offset? Do you think that something like regular eye tests done through the company are worth trialing, or is it better to kind of issue vouchers and expect drivers to do it?
Yeah, I think the fundamental thing is to make it as easy as possible for anyone to attend for an eye examination. It's not an invasive procedure or process. The most difficult thing one would have, what we find, I mean, I'm an optometrist myself, so the most difficult thing I find with my patients is that just taking that first step coming through the door. Once they've taken that step, it's a very easy process. As long as they do it regularly, it's a worrying fact that people attend the dentist far more than they attend the optometrist. Yet they actually value losing their sight far more than the taste or with the teeth. So it's a very quick process. It's very easy to do. You can do a lot of self-help as well, and I think it's worthwhile doing, but nothing can really beat an eye examination. You can find out indicators, or you can find out from looking at a number plate whether you can see right, but the changes are so gradual that it's very difficult for one to notice. Even myself as an optometrist, for one day to another day, I can rarely tell the differences that the reduction that happened with my eyes. Whereas if I go every 2 years, that's far better, and you get far more of an objective view of what you're actually missing, because you never can tell what you're missing.
Yeah, that's great, and we'll circulate the free eye test voucher as well after. We'll email that out to all the attendees after. Thank you, Omar.
Thank you.
We're just going to hand over to Julianne Little now. Hi, Julianne.
Hello. Now, can everyone hear me?
Yes.
Great. Let me just start this slideshow. For some reason, I am not. Okay. Okay, sorry about that. Thanks everyone, and thanks to Break for inviting me to be part of this webinar. It's interesting to get together and think about how our everyday world of vision relates to that of driving, and especially considerations of employees and the responsibility of companies with regard to trying to enhance good driving habits and good visual vision for your employees. My name's Julianne Little, and I'm a counsellor for the Association of Optometrists and also part of a vision and driving working group. And today I'm just going to really finish from our last two speakers by talking a little bit more about those legal requirements for driving and where they came from, and just understanding them a little better. And then talking about visual acuity and visual fields, and some other aspects of vision that are important for driving. And then I'm going to finish on the risks of poor vision and what we can do as clinicians in eye care, and what companies can do to help promote good vision for driving. So vision, of course, is one key aspect of driving in concert with good cognitive abilities and also good motor function to control a vehicle. Driving is a really key means in our society for independence and for mobility, and it's recognized that we, all want to be full and independent members of society, and there are a significant number of drivers in our population in the UK and across Europe. The European Commission had the ambitious target to have the number of road deaths by 2020. And with that, in the early 2000s, they undertook a review of their legislation on driving licenses and what different countries did across Europe with regard to requirements for driving. And this really culminated in an update in 2009 on the driving directive standard. And member countries then were required to align with those standards by 2013. So in the UK, our Department of Transport then made some small amendments to their vision standards for driving to fall in line with that. So the European directive really, as I say, comes from a place that's very important in the European Commission for driving, because over 60% of the European population have a driving license. And with the free movement across countries, there are many drivers that regularly move from country to country, and it facilitates mobility if we all are working on the same common platform. This is becoming perhaps less important for us in the UK with Brexit, and also I think we always regard ourselves as an island nation. But it is important to remember that actually we do have a land border with another European country. And you might be able to tell from my accent that I come from that other island. Part of work I undertook for the European Council of Optometry and Optics, which is an association which promotes good practice for optometrists across Europe, was to answer the question about, do countries across Europe actually have aligned visual standards after the directive was implemented? And the answer was really yes and no, that there actually was good alignment on paper with regard to the visual acuity requirements for driving, but a very large variation in how those standards are interpreted and how they're implemented in country. So in some countries, it's very routine and very common for there to be in-person assessment for driving. And that is not just for vision, it's for medical assessments as well. While other countries, such as the United Kingdom, very much rely on self-reporting and very much put the onus on the individual to make that assessment. So I'll not go into any more detail, but I have just grabbed one table from this report, which lists the countries, and on the columns we see the variation in visual assessments that are done across different countries. From, on the right hand side, the very basic license plate self-test, to then more going left, then more comprehensive measures of vision and visual function. So back to the UK, we've talked a little bit about the number plate test and how that is still our standard. And when I think about when I went as a young lady of 17, very keen to get my driving test, I arrived at the driving test examination centre and met my examiner. He took me out to the car, and roughly 20 meters across the car park there was a vehicle sitting. It was a pretty dull day, and I was asked to read the number plate, which I did. And no one will test my vision ever again for driving unless I declare that there's a reason that should be done. At the time of filling in the license form, I also probably made a disclosure as to whether I wore glasses or contact lenses to correct my vision. And at that time, I didn't. But if I had, on the back of my driving license, at the very bottom row, there's something called information codes. And these codes relate to things that you've declared or disclosed on your driving license application. And if you have a 01, if anybody wants to look at their license, and if they have a 01, that means that you require an eyesight correction for driving, and you've declared that at some point. Interestingly, if anybody has a 115, I was curious when I looked at my license to know what that meant, and that actually meant that I was an organ donor. So I've ticked the box somewhere along the line, and that appears in my license. So, just some of the things we've talked about and Omar touched upon was the fact was the visual acuity requirements for driving, but the fact that actually there's slightly different classifications depending on what group you fall into. And since the 1930s in the UK, there has been a legal distinction between what's so-called ordinary drivers or everyday drivers and vocational drivers, or drivers that do so for employment or occupational purposes. Now, Group 1, which many of us will fall into, are cars and motorcycles, and then Group 2 are heavy goods vehicles and passenger transport vehicles. So depending on the companies, many companies will have employees that still fall into that Group 1 category, even though they have a company car or use a company vehicle of some description. But others then will be very much the Group 2 standard. And those that are Group 2 drivers then must meet higher medical standards. And the theory is that due to them spending more time on the road. So the actual directive, I'll not quote it to you word for word, but essentially, in summary, for Group 1 drivers, we require a binocular visual acuity of around 612 Snellen equivalent, and we often use that unit of measurement in vision, but it also could be described in decimal form, or it also could be described in something called logmar form. In a way, it doesn't really matter to you, but it is roughly equivalent to the size of a number plate at roughly 20 meters away, which is why in the UK we still hold to that number plate test. But another interesting thing about that is that you don't need two eyes to do this. It's you could have vision only in one eye, but as long as you make that visual acuity threshold, then that's fine. There's also a little bit of requirement on visual fields, and I'll talk about that in a second. But the photograph of the visual acuity chart here just shows with the red line roughly where that should lie with regard to meeting a visual standard for driving. And I just want you to notice from that is that it's nowhere near the bottom line of the chart. A visual requirement for a driver isn't asking that they have super duper detailed vision. They're asking that whether they need glasses to do it or not, they have vision that's good enough to pass that red bar or that red line and to meet that standard. Now, for Group 2 drivers, then it is a little bit more strict in that you do need some sort of vision in both eyes. So you can have you can have a better eye and a worse eye, but your poorer eye does need a certain level of vision as well. So you can't be binocular and be a Group 2 driver. Now, years ago, there was when that standard changed, there probably are some older drivers out there that still possibly have a Group 2 license, even though they wouldn't meet this standard because of what's called grandfather rights that came in. But for any new Group 2 drivers, they need to have decent vision in both eyes. As Omar mentioned, then the requirement for that better eye, or for that overall vision, is a bit more stringent with Group 2 drivers. They need to get further down that chart. Whether they need glasses for that or not, they need to get further down that chart. And they also have a bit more requirements about their visual fields as well. So I mentioned the number plate test already, but as I said, we're very much still wedded to it in the UK as a proxy for a visual acuity measure, because the Department for Transport likes the idea that it's a self-assessment tool, that anybody can check their vision at any time. And they also argue that the police then can use it for roadside assessments. I do think that it's an underutilized thing, and I think that actually people have a relatively poor perception of what their vision, what that standard is. And if people do measure it, they tend to underestimate the distance that they're required to measure it at. But nevertheless, we're still wedded to that test for the moment. I've mentioned visual fields a little, and I think it is useful to talk about what we mean by that, because again, in the world of vision, we know, or we have a good understanding about what that means. But it essentially means at any one point where your head and body is positioned, the degree of visual angle that you can see at any one time. Now, you'll not be paying attention to all your visual field at any one time. You'll probably be looking straight ahead, or in the center of that, paying attention more in the center of that vision. But you'll have an awareness across that visual field, and you'll sense movement in that visual field, probably if it's not too peripheral to your vision. And this diagram here just shows, looking down from above, if someone is looking straight ahead, that visual awareness that they would have. And the larger angle there is the overall angle that two eyes can give us, and then the bit in the middle is where they overlap then the binocular field of view. So there are, as I mentioned, slightly different requirements for Group 2 and 1 drivers. But again, we rely very much on self-reporting. People need to disclose whether or not they feel they meet that standard, and that's a very difficult thing for a driver to do. This, if it ever does come up that it is a difficulty, there are tests that we can do to try to establish what somebody's binocular vision is for driving. But these tests aren't ideal. They're a fairly sort of blunt instrument, and there are a little bit more detail in the rules and regulations about the fact that we're allowed a little bit of defect in some areas, but no defect within the very central area of our vision. Visual fields, though, comes up time and again with regard to ocular diseases or conditions, and you heard Rebekka talk about it, particularly with the eye disease glaucoma. And quite often when we try to talk about the visual field defects or constriction of the visual field, we might show a photograph, something like panel A here, or photograph A, where we show that there's a constriction where somebody's only seeing the central area of this picture, and there's a big black edge to this. But actually, people with visual field problems don't see black areas in their vision like that. Our brain is very good at filling things in and making us feel that we're having a complete picture, even though we're not. And actually, a really interesting little piece of work is summarized in these photographs, where people with visual field defects, so people with glaucoma that had visual field defects, were asked to look at these pictures and match which one closely represents how they feel they see. And about half of people actually felt that they have no problem, and they felt that they could see like photograph F. They think there's no particular difference. And about half of people acknowledged that there was maybe a bit of a difference, and they chose panel D, where they saw maybe a little bit of blurring. But I think that was really interesting to highlight that we don't feel that we have a problem often, even when it is something that can be picked up clinically. I'm just going to move on to just briefly some other aspects of vision that are important and we can measure, and that's really to tap into the fact that vision is in the real world is much more than just our measure of visual acuity or how small a letter we can see, or indeed our visual fields. And vision also occurs across a wide range of conditions in the environment and adverse weather. So under conditions of night driving or bright sunlight or the pouring rain, as is common in the UK, then we might feel very differently about our vision and visual clarity than we would on a good day. And another thing, I think, when I look at studies from across the world, the likes of Australia and America, who do quite a lot in vision and driving, some groups, they tend to be in areas where there's actually relatively little difference across the year in the hours of daylight. But here we're very far north in terms of latitude in the world, and we have very big differences in the hours of daylight between our summer and winter. And we do proportionally drive a lot at night or in darkness conditions, either in the morning or in the evening, both of which are potentially at times of peak traffic. So I mentioned that there are other ways we can measure vision across, which gives a fuller picture of vision, and that includes contrast sensitivity, it includes glare measurements, or potentially twilight vision to try to tap into that idea of how well we do under low lighting conditions. And the regulations also do talk about that as well. They do talk about you know, how we should pay attention to these sorts of conditions or any visual functions that can compromise safe driving. But the problem is that there really are no standardized or established tests for these kind of conditions. So whilst we as eye care people can measure those sorts of things, there's no kind of sense of what is good enough or what is not good enough to make us a safe driver. But it is interesting that in Ireland, the Republic of Ireland, the legislation around vision and driving very much discusses and describes contrast and glare and twilight vision, and the visual assessments there go far beyond that of the UK, and all drivers are expected to have an eyesight test on application for a driving licence. And I think that's something that is actually where a neighbouring country goes far beyond and probably has far better regulations with regard to us. So just to finish, really, in the last few slides, I just wanted to really summarise that there are risks to having poor vision with driving. And that includes the fact that people tend to be poor judges of their visual quality, and we tend to overestimate ourselves in lots of ways. Nobody wants to be average or below average, but we do tend to think of ourselves and think of our abilities as a little bit better perhaps than they are. And I mentioned before that UK drivers have a relatively poor understanding of the number plate test, and also their responsibility of that self-report, and that the fact that they declare they have good vision every time they get behind a wheel. You already heard that some statistics about the drivers not always getting regular eye examinations, but a couple of interesting things from a brake survey that was done a couple of years ago was actually that a minority of people admitted to driving without their glasses in the past 12 months. And almost 20% reported delay in going for an eye test even after noticing problems with their vision. And I think that second point really taps into the fact that there are probably barriers to eye care and to people accessing eye care, perhaps because of perceived costs, or perhaps because they think that their vision is okay and they'll only maybe attend reluctantly if they think that there's a decrease. But I would say that it's often, you know, it should be a positive experience. We want to be there to be able to maximize vision and not be harbingers of doom with regard to this. There is an increasing number of older drivers in our population, and that's something with increasing numbers of people on the road that is a concern for the Department of Transport, because for a number of medical reasons in general, but also with regard to visual standards, that visual acuity does decrease with age, and night driving will become visually more difficult with age. And with that reduction in vision, it will affect reaction times and will slow that down. And that's even without having somebody actually having an ocular disease. But of course, age increases those risks of problems as well. So you've already heard a lot about those ocular diseases, but all of them will in some way feed into either that reduction in vision, increasing glare, or that reduction in visual fields. So what we want to do in our role as eye care practitioners is to maximize vision and to give people good clinical advice with regard to vision. If somebody does need spectacles to correct their vision well, we want to advise on the appropriate appropriate lens size, appropriate shape, appropriate frame, and also the appropriate lenses with anti-reflection coatings and so on. And we want to keep people driving safely. We want to keep people on the road and independent where they can. And it really does make us sad whenever things like Cassie McCord's case came into the news, or other cases that just happened more recently where somebody unfortunately was responsible for the death of another individual due to their poor vision, because all those things should be avoidable. So what companies can do then is really try to encourage good awareness of the importance of eye care and promote good eye care habits. And I think I was really fascinated to hear that actually, with regard to the number of drivers on the road, that 1 in 3 vehicles are workers or are employees of companies. So we need to, and you have a responsibility to ensure good driving habits in your employees. And I think, you know, a couple of other just really simple things is about that. We've talked about vision and the need for that, but keeping cars clean and keeping windscreens clean, making sure that windscreen wipers are working well, and that our water bottles are topped up is all really, really important. So I'll just leave you with that final slide, but thanks very much for your attention, and I'm happy to take any questions.
That's great. Thank you, Julianne. We haven't had any questions in from the audience. I think that was really interesting to see the key points there on just something as simple as keeping your windscreen clear or free from distractions in the vehicle can be just as important as obviously the health side of things. Thank you for doing that. Just going to pass over to Nigel.
Hello, can you hear me okay?
Yeah, that's perfect.
Brilliant. Okay, yeah, good afternoon everybody. My name is Nigel Lawrence, Head of Projects and Implementation at Applied Driving Techniques. I think my kind of positioning as a presenter this afternoon follows on really, really well from the other presenters, in the sense that I think it's been made very, very clear where the kind of importance around eye care and regular eye tests comes in. So this kind of brings me on nicely to a few slides that won't take too long to go through, but just to kind of give everybody a bit of an idea on kind of a duty of care risk assessment process that we currently administer for one of our customers, Ashfield Healthcare, and a bit of a case study around kind of best practice and what Ashfield Healthcare do in conjunction with ourselves in relation to eye test screening and how that forms part of their risk assessment process. So quick background, who are Ashfield Healthcare initially? So they're an international healthcare services provider, and they form part of the global UDG group, and their role is to provide an outsourced service, and they support the pharmaceutical industry and healthcare professionals. So as an employer, they are responsible for contracting in professionals within those two industry types. They currently work with among the top 20 global pharmaceutical companies with 6,000 employees worldwide. And in terms of employees who drive for work in the UK and Republic of Ireland, that currently accounts for around 1,400 drivers in total. A little bit about us, Supply Driving. So we're a UK-based award-winning work-related road risk fleet safety consultancy. We've worked very closely with Brake over the years and won a number of awards with Brake for a number of our customers. And kind of our portfolio is generally across an outsourced service arrangement, which this case study forms part of it, where we're providing a fully managed driver risk management solution. Our role effectively is to work very, very closely with our clients to ensure that they're meeting legal compliance and covering all of their duty of care and health and safety requirements in relation to staff who work and drive on business. A very brief kind of slide around sort of driving at work generally. I think it's fair to say that it is a very high-risk environment, and really it's the most dangerous activity that any employer will expect its employees to undertake whilst working on behalf of the organisation. There are very clear legal requirements in terms of employers and their duty of care towards their staff, and it makes absolute sense that all reasonable steps are taken to protect the safety of their staff, and not to forget as well the safety for the general members of the public. In terms of legal obligations, it's very clearly defined around duty of care and health and safety at work. And again, things like corporate manslaughter, and very clear legislation for those. And in terms of the risk assessment process, something that we undertake for Ashfield, all employees who undertake that process will potentially go through a level of risk mitigation when necessary in terms of higher risk drivers. As part of that risk assessment process, we also have a section that relates to eye test screening. So this is where employees, as they go through that process, will be asked to indicate when they last had an eye test, which I'll talk about on the next slide in a bit more detail. And in terms of penalty, I mean, again, you know, talking about risk of legislation, non-compliance in the event that the worst case scenario applies. I think it's fair to say that there isn't an organisation out there that would want to be in a position where they had a disclosure order in terms of publicity and potential 10% of annual company turnover in terms of a fine. So a little bit about Ashfield and how Ashfield have approached eye test screening. So one of the things that's really, really important, and when we first started working with Ashfield about 2 years ago now, was to make sure that the driver safety policy and handbooks had a very, very clear understanding and guidance to employees, not just around the importance of eye care and having regular eye tests, but actually what the internal procedure is. As we find very commonly, a lot of organisations will have procedures in place within policies, but actually no real operational understanding or guidance of how that process works. So quite often you'll be in a scenario where, for example, an organisation has an eye care scheme where they may give or contribute towards eye care vouchers for anybody who wants to have an eye test, but actually the employee themselves doesn't actually know where to find that and how to find, you know, the necessary procedure in order to do that. So it's very, very important that that's properly publicised. The online risk assessment process that all drivers do as part of the outsourced service we provide to Ashfield includes the section that asks for every employee to indicate how long it's been since they've had an eye test. So that will be in a drop-down fashion, so they'll be able to give an option of under 2 years, 2 to 5 years, 6 to 10 years, and then over 10 years. That service is really, really important for Ashfield and for a number of our customers because there's an audit trail around that. The process in terms of the risk assessments are repeated on an annual basis, so it's not just for new starters. We're also capturing this information on an annual basis for employees as they go. So in terms of kind of what we do with that and the notification process, so initially we have a very bespoke scheduled reporting process that applies for this particular organisation, of which part of that is eye test reporting. So all we simply do is just report to the organisation, you know, notifying them of any individuals who have not had an eye test within the last 2 years. Everything is coordinated through the fleet department at Ashfield, and they will then contact the employee directly, and they'll detail the importance with a reference to their own internal policy, which states what they would need to be able to do in order to get a free eye test. So as it says on the slide, that employee can then contact the HR department for the eye test voucher. And I think probably in addition to that, the key last bullet there is that the fleet department also issue out some general eye care advice bulletins periodically. So that kind of goes back to one of the questions that was asked of one of the original presenters around kind of, well, actually, how do we promote awareness around this particular subject? Just simple little things like that being issued out periodically, 2-3 times a year, however often it may be, is an awful lot more than what probably most organisations do. So again, this really does support the kind of best practice approach that certainly Ashfield as an organisation are taking in regards to that. And what we would then also do as part of the reporting process is that for any individuals who have had an invite to take an eye test following the reporting, when they then repeat the risk assessment the following year, we will then provide some additional reporting levels as well to make sure that actually those individuals who have been issued a communication have indeed taken an eye test in that year. It's kind of on really just to summarise those short slides. I mean, you know, we've reiterated quite clearly how driving on business is a particularly high risk activity, you know, and naturally eye care forms a large part of that, you know. Ashfield as an organisation have a lot of staff on the road doing a lot of miles every year, and again, you know, risk of fatigue is there. You know, eye care is naturally a contributor to that. Seriously important to ensure that the safety of employees is being protected. You know, the legal requirements are there. Nothing in any way is more important than the safety of the staff. Kind of in addition to that, really, and potentially this is where in partnership with Break and ADT, that this would be of interest potentially to new and existing members. With effect from the 1st of May this year, we'll be offering to all new and existing Break members a complimentary audit. This is where we'll do a bit of a sort of audit, initially by telephone, in terms of kind of what's in place around policies and procedures for organisations. And again, you know, eye testing would form part of the question set for that audit process. And then we'll provide a bit of a gap analysis and recommendations report in terms of the findings from that initial audit, which again could be a benefit to you know, all organisations who potentially are worried at risk of non-compliance, and having something that actually highlights where those potential gaps in compliance are. That's everything from me today in terms of that case study. Happy to take any questions if there are any.
That's great. Thank you, Nigel. There's one question on who, obviously at-risk drivers are quite hard to pin down in terms of if they are people who often speed or are often distracted while driving, and obviously something like healthcare, which can be quite a personal thing, is even harder to get for a company to come and get involved with. So in terms of cost risk analysis, is that the best way to kind of get upper management buy-in if you are looking to introduce eye care vouchers or make health a bigger part of your company policy? What would you say the best route is to get management buy-in?
As kind of with all kind of process in terms of fleet safety, the culture within the organisation, whether it exists in any shape or form at all or has been developed over time, is particularly important. So I think level of engagement is the most important thing, certainly when attempting to get buy-in, and that's not just at sort of board or manager level, that's also at you know, at all levels across the organisation, because it's very easy to actually apply processes like, you know, like this, for example, where we're going to be doing a risk assessment for all our staff. We're going to be asking you questions around, you know, things like, you know, collisions and what have you. Eye tests form part of that. But the key part of that engagement process is actually making it very, very clear why why the staff are being expected to undergo this process. Why are they being asked to complete this? Because actually it's very easy to see it as kind of a, oh, well, we're doing a tick box exercise, and, you know, where does the actual benefit, you know, come to me as an employee? Well, actually, when you engage at the very, very start of this sort of process and make it clear, you know, there are legal obligations, you know, our duty of care towards you as our staff, you know, is absolutely paramount. You know, once you've got that kind of level of engagement up front in the very first instance, you tend to find that that buy-in becomes a lot easier, but it doesn't necessarily come straight away. It does sometimes take some time. But you've got to kind of drip feed that information and drip feed that through over a period of time.
All right, that's great. Thank you, Nigel.
Okay.
And thank you to all of our speakers today. Copies of their presentations and a recording of this webinar will be available online shortly. We also have a number of webinars coming up in the coming months, which are on screen now. So to register, or if you have any questions, just drop us an email on professional@break.org.uk. Thank you.